Dr. Fauci, this brings me to the question of booster shots, which everybody is freaking out about. Does the severity of Delta demand booster shots now?
No, let me explain why. It's a simple and understandable question, very crisp and clear, but it is not a crisp and clear answer. Let me explain. When you say booster, you've got to divide it into whom are you talking about? So with regard to immune compromised people, those who are transplant patients, those who are on cancer chemotherapy, those who are on immunosuppressive doses of regimens because of autoimmune diseases, for example. It is clear now that those individuals never did get an adequate response for the most part. And we never talk about 100%, but for the most part, those people never did get a good response. So we're not talking about the durability of their response. We're talking about whether they got a good response to begin with. So those individuals, in my opinion, as a physician, and that's why I'm quite vocal about it, I think we should be addressing the issue of getting them an additional shot quickly. So I'm looking for a very expedited decision, and whatever that mechanism is, whether that's an amendment to the EUA, whether that's going quickly through a BLA, whatever you want to do, those are the people that we
who
know
need to
now
go in to get those booster shots. I hear you, Dr. Fauci, but I am curious about the World Health Organization's moratorium on boosters from this week. Does that change your thinking at all on pushing people to go in for boosters?
You know, Madison, it doesn't, because I think we can do both. And if you look at the history of what the United States has done over the last several months, since President Biden took over the presidency, you will see that we have done more than all other countries combined. We now have 500 million doses that are committed to go. We've already given 110 million to 60 countries. We have promised 500 million plus the 80 million of our own. We've given $4 billion to COVAX. Do we need to do more? Let me be very clear. Yes, we do need to do more for the low and middle income countries. But I believe we can take care of that at the same time we make sure we optimize the protection of our own country.
Thanks for watching Bloomberg Quick Take Now. Subscribe to our channel to see the biggest stories the moment they happen from around the world. And tune into our 24/7 live stream for global news coverage, interviews, deep dives, shows, and documentaries on the stories you care about most.